Welcome back to Capital Confessions. We are moving along with organic plant poisons, and the second part of this is going to be covering three more organic plant toxins. We're going to be covering Semecarpus anacardium, we are going to be covering Calotropis, and of course we are going to be covering our good old chili, which is called as Capsacin. These three are very important from the point of view of vivas and short answer questions. They are basically questions that are not conforming to your traditional LAQs, but they are more of topics that you're going to be requiring if you're a third year MBBS student and you're going for your practical and for your vivas. So that is where these topics come into play. The learning objectives are going to be exactly similar as what we did the last time. They are going to be about the signs and symptoms of those particular toxins, the typical features, management strategies, and of course the medico-legal importance. Medico-legal importance cannot be understated whenever you are doing anything in forensic medicine or in toxicology. We start again with a case scenario. See, these sort of questions generally come along with a case scenario, whether you are appearing for your NEET PGs, if you are an FMG person, or maybe you are just a third year student who is trying to pass out forensic medicine and toxicology. Case scenarios are always going to be important. Now here what we have is a case scenario of a 25-year-old man who reports to the emergency room with painful blisters on the arms and the lips. Now he admitted to using a particular traditional remedy or a folk remedy for relieving joint pain, or also called as rheumatic pain. Now this particular person, if you look at it, he has these painful vesications along with blisters that are present over the lips, little part below the lips, and of course the area where he is predominantly affected. This sort of a presentation generally occurs due to an irritant substance, and this particular irritant substance on examination showed that the ulcerated lesions were present and he had brown urine. The urine was effectively brown in color. His vitals, his heart rate was elevated, so this person was in tachycardia. The blood pressure was following, so he was actually in a state of hypotension. Within 6 hours, he developed delirium, that is an altered sensorium state, and he got respiratory distress. Now, all of this occurred due to a folk remedy which is causing ulcerations here, and of course, it is causing vesicated ulcers over the parts of the exposed skin. This particular presentation is something that we see in Semecarpus anacardium. It is also called as marking nut. Marking nut, it has other names also. It's called as bilavan, it is called as bhatlaka. Now the common regional differences, I'm going to tell you the regional names, but basically it is a brown or a dark brown seed that is coming from a plant. Now this seed has its consistency very hard on the outside but very easy to be crushed, and on crushing you get an oily irritant juice. This particular juice is going to be thick, it's going to be viscous, and it is highly irritant to the skin. Now this particular juice is the toxic part. It is where all the toxins or all the poisons are there and they are settled down. The active principles are two. They are called as semicarpol and bilavanol. Now semicarpol and bilavanol both have the same output. They give the same sort of a presentation, but the modalities of achieving them are predominantly irritant in nature. So they don't exactly have a lot of systemic manifestation in terms of an in-depth mechanism, whether they are affecting some sort of a channel or if they are affecting some gateway or inhibiting protein like we saw in the earlier ones. No, it is purely irritant in nature. What happens is, upon administration, it can be local administration, so over the skin, or ingestion. On local irritation, on local application, they cause skin irritation. They're going to cause blisters and they are going to cause superficial ulcerations. That is the presentation that you find on these particular compounds when they are exposed to the skin. Okay, and this is of course the most commonest presentation for Semecarpus anacardium. It is going to be mostly seen as local application. But orally, if it is ingested, this is rare. Either it is going to be part of a folk remedy, or maybe a child is going to go and accidentally ingest it. There's going to be blisters in the mouth. There's going to be severe GI irritation. This includes nausea, vomiting, diarrhea, abdominal pain, diarrhea with or without blood. All of this is going to be present, and this causes further delirium and coma. All of those symptoms are as a result of the irritant activity, and the resultant complications arise due to that. Systemic manifestations, of course, tachycardia. This occurs due to release of adrenaline as a response to the irritation. You have cyanosis, hypotension, and renal cortical necrosis. Renal cortical necrosis is a very real danger with Semecarpus anacardium. The local applications are generally self-limiting in nature. So if you have some local applications, soothing creams, those sort of treatments, they will go away. If the oral injection is not very high in quantity, if the amount of poison is relatively low, you're going to get maybe blisters in the mouth, thoda bahut swelling here or there, some GI distress, again self-limiting. But if the amount of seed oil, that is the amount of semicarpol, is very high in the blood, you're going to get these particular conditions, right? In these particular conditions, the most dangerous, of course, is renal cortical necrosis. There is also something called as Gobi dermatitis. Now, this can be asked as an MCQ or a Viva question. It's actually very nice answer twist. Gobi dermatitis occurs because one of the predominant uses of Semecarpus anacardium was as something called as a marking nut. So the people, the washer people, the dhobis, they tend to take this and they mark the clothes for identification using this particular nut, because easily soluble in water, does not leave a mark. We can mark it, set it out for dry, put some water at the end, it goes away. But exposure to this semicardium on the hands causes Gobi dermatitis. It is a type of dermatitis. Marking nut, again, not something very dangerous, but the fatal dose is 5 to 10 grams of semicarpol or 5 to 8 seeds that are chewed and then ingested. You have to chew and ingest them. The thing about this particular poison is the seeds of Semecarpus, even if you ingest them whole, you might get manifestations. Contrast this with something like Abrus pregatorius, where you have to chew them to get manifestations. Here, even if you don't chew them, they mix with the gastric juice, they are still going to release semicarpol in the system. Fatal period is between 12 to 24 hours. That is when the amount of semicarpol is very high, the quantity of marking that has been consumed is very high. Local application generally does not cause death. The management is purely symptomatic in nature. So you have to wash your skin, apply some liniments, some soothing agents, use demulcents if there is some GI distress to coat the entire GIT, reduce the irritant activity, and thereafter give symptomatic care. If the individual does develop very severe renal cortical necrosis, he is going to be liable to require fluids, replenishments, and of course hemodialysis at a later stage. The medico-legal aspects include, of course, this is used by washerwomen to mark the clothes, that is one of the uses of it. Quacks or folk medicine practitioners do tend to use this to relieve rheumatic pain. It does not have a very systemic sort of effect on joint pain, more of a local irritant effect, kind of like what balm tend to do. They give a counter irritant activity. Criminal use, it was used as an abortifacient. So take an abortion stick, at the end of it you put something like Semecarpus and then you insert it so as to cause abortion. It causes abortion due to its effect, its irritant effect. Malingerers do tend to use it for producing something called as artificial bruises. We will be focusing more on that in a minute. Artificial bruises, or if you take a drop of Semecarpus while you put it in the eye, it gives you conjunctivitis. So that is used by malingerers. Malingering basically means that faking a disease. Happens if you want to go to school one day, take a little bit of Semecarpus. I mean, don't do it, but if you take a little bit of Semecarpus, you rub it, you say, oh, I've got there's a contusion right here, or I've got conjunctivitis. Rarely this is used in homicide or suicide. This is not exactly a poison or assault. It's more used for malingerings and maybe used by quacks. Speaking of malingering, artificial bruises, very, very important question. This is asked as a short answer question many times, and there are multiple points that are asked and differences between artificial and true bruise. Now, suppose this comes for a 5-mark question. Generally, you are required to put at least 8 specific points to get those 4 or 5 marks. This is the thing, you have to have 8 points. We're going to be going one by one. A true bruise generally is always going to have a causative agent. It's going to have a blunt trauma or a mechanical injury, whereas an artificial bruise is always going to be due to an irritant drug. The color changes are present in a bruise. Initially it's going to be red, then it goes to blue, green, yellow, so on and so forth. Whereas artificial bruises, they start with a very dark color, a very dense color, and thereafter the color fades away. There is no progression, there is no change in color. It is just a color that is fading away. These shapes are usually round or irregular. If a certain object is involved in causing a true bruise, that particular object's imprint may be present. Here again they are irregular, but they are often not going to be matching any object. People tend to just rub the marking nut over the skin, so it has a very irregular shape to it. It can occur any side part of the body, especially over the bony prominences, but artificial bruises are always going to be over accessible or exposed parts of the body. They are going to be in areas where your hand can reach and cause a particular bruise. The margins are going to be very ill-defined, they're going to be diffuse and irregular, but in artificial bruise what happens is, because they are following a set pattern, like this is the area I want to create the artificial bruise in, so it's going to have very well-defined margins, it's going to be very specific. Redness and inflammation, that is the 4 signs of inflammation, rubor, calotropis or tumor, all 4 are going to be present if you have a contusion that is caused by a mechanical injury or a true contusion. Here you will not see just the redness and inflammation on that particular area. It's going to be actually seen in the surrounding area as well, not just the area of the contusion, because this is an irritant compound. It's going to inflame the entire skin around it. Itching is going to be generally absent when contusions are there, because it is sensitive, it is painful, but generally in cases of Semecarpus use, itching is present because now it becomes very irritant, kind of like a mosquito bite. There are no vesicles and no blister present. Typically, you will find vesicles and blisters as a result of Semecarpus and cardium. The reason for this particular false bruise or artificial bruise is the irritant fluid. But here, the cause is going to be due to pooling of the blood, which is why you have those color changes. Here, it is just that irritant fluid which is causing inflammation and desiccation. If you do happen to get it on a dead body, you cut it out, you send it for histopathology, we will find RBCs and inflammatory cells, but under the microscope, in artificial bruise, no such thing is seen. Chemical testing, if you have access to it, is going to be testing positive for bilaminol or for semicardium toxins. There may be tenderness, swelling. This is generally associated with some sort of ulceration or vesications. And lastly, all true bruises are due to some or the other mechanical injury, could be either accidental, homicidal, but here they are often fabricated injuries, and individual is going to have a history of malingering or maybe wanting to do something or maybe not do something on false allegations. Next up, this is again a very small toxin, but important nonetheless because it's widely seen in major part of the country. We call this Calotropis. Now, Calotropis actually comes in 2 major variants. So you have your Calotropis gigantea, which is this one, and you have Calotropis procera, which has white flowers. These petals are effectively going to be white. The central area may be slightly purple, but this particular area is going to be white. That is Calotropis procera. Calotropis is the next organic plant poison. Now, this particular plant poison is important because we tend to find it very commonly. It's a wild plant, grows almost anywhere. There's good access to humidity. Active principles include ascarin, calotoxin, galactin, gigantin, and of course calotropin. Among them, the most important for us is going to be calotoxin and calotropin. So this calotoxin and calotropin, these are the two which are the most important for us. This is also an irritant plant. It is also having irritant properties. The clinical symptoms again very similar to what we found in Semecarpus. It is going to have redness, it is going to have blisters. Yes, I know, a lot of overlapping here. It can cause conjunctivitis, and it can also cause visual loss because of its irritant activity and ulcerations over the cornea. It does cause burning pain, vomiting, diarrhea. All of these are present. It does not cause cortical damage in the kidneys, but what on the other hand does is it causes circulatory collapse. It causes convulsions. It causes diseases that are considered to be more dangerous and more life-threatening as compared to Semecarpus and Acardium. And how it does that is, it has an intrinsic mechanism of action in which the sodium-potassium pump is effectively inhibited. So you have very low activity of sodium-potassium pumps, and specifically it targets two types of cells. It's going to either target the neuroglial cells, or it's going to target the cardiac cells. Now this disrupts homeostasis, this disrupts the balance, and it leads to an increase in intracellular sodium. So a lot of sodium is being built up inside. You have a lot of acidosis, and of course you have an increase in calcium levels. All that is going to disrupt normal cardiac activity. So if normal cardiac activity is not functioning, normal neurological activity is not happening, this causes the individual to have convulsions, go into comatose state, and possibly die. The fatal period is approximately 12 hours. It is actually variable. It depends of course on the individual, but generally 6 to 12 hours is the fatal period. We say approximately 12 hours, and the treatment modality is there is no specific antidote. We give gastric lavage, we use demulcents. If there is pain, we use morphine, very effective in pain, and of course we provide symptomatic or supportive care. The treatment modalities are entirely supportive in nature. We have to flush out the toxin. It is not an accumulative toxin in nature. Once it exerts its effect, it starts being degraded and leaving the body. It is used again as a vesicant. It is used as a part of local folk therapy, folk treatments for chronic skin conditions. Criminal abortion, same use as Semecarpus and Acardium, abortion stick. Infanticide, this is one of the things. What happens is, Calotropis has a poison called as calotropin. It is, if you take a Calotropis plant and you happen to break the leaves or the stem, you're going to find a white latex sort of a juice coming out of it. That juice is very similar to how milk looks. So people tend to mix it with milk and then give it to the baby. Baby is going to develop convulsions, coma, and then going to die. So it is used in infanticide. It is not detectable in milk. Cattle poisoning, it is inserted rectally, and it is also used as an arrow poison. If you remember the session, previous sessions, you will find that Abrus piccatorius was used as an arrow poison. Calotropis is the second one. The third one is going to be strychnine, which we will do later on. It does cause artificial bruises, but not as prominently, not as similar to true bruises as Semecarpus and Acardium. And it was initially thought that snake charmers tend to use this particular toxin to subdue snakes. This was a thought process later on. I cannot verify it, but it was written in the literature search I did. Last, and we always tend to save the hottest things for last. So the hottest toxin on the list today is your homemade good old green chili. This is called as Capsicum anum. That's right, Capsicum anum. Dude, have a lot of chili, your anum is going to be burning tomorrow morning, right? So Capsicum anum is basically our next poison for the day. Capsicum anum, also called as chili, it has two major active principles. You have your capsaicin and you have your capsicin. So capsacin and capsicin both are very important. Among them, of course, the capsicin component is what gives you that typical burning hot taste for a particular chili. It is generally not fatal. So even an overdose with chili might not kill a person, might die from neurogenic shock, might die from some other complication, but chili itself directly do not contribute to death. The symptoms, of course, everybody's tried chili. is irritation, is vesication, so it's redness, tears. So if you have a nice big chili bite of it, your eyes are going to water up, burning, redness along the face as well as the region affected, burning in the mouth, throat, and GIT irritation. So yes, if you have a lot of chili, it's going to upset your stomach. Treatment, it's all localized. Wash with water, symptomatic relief, use emulsions, antibiotics and corticosteroids. If your local effects are very severe, so you tend to do antibiotics or corticosteroids. There is a specific condition related to chili in which we use this. And scrape the tongue and suck eyes. Water itself is not very helpful. Things like buttermilk or curd are better. It does have a lot of medico-legal applications. This is generally thrown into the eyes during a robbery to run up to the police to cause some sort of a disorientation to the person, used in torture. It is used as a punishment modality, and there are superstitions that if you take a piece of chili, you do this in front of the person and then you burn it, the evil eye goes away. All of those superstitions are present. An important point with chili is that there is something called as the contact dermatitis effects due to chili exposure, in which you have something called as a Hunan hand.